Next thing is the pause training, which is a prosthetic and an orthotic. We all know what a prosthetic is. A prosthetic device is a replacement device. An orthotic device is not a replacement device. So a prosthetic device can act as a function of the prior organ or tissue that has been replaced. So physicians usually give training on how to make use of such devices. So for that we can also have specific codes. Next is nutrition therapy that is being given by dietitians. We have codes based on the time that the healthcare provider spends. We'll move on to the next thing, which is the acupuncture. Acupuncture is a word that can be split up as accus plus punctura. Accus meaning needle, punctura to make a hole. Okay, here acupuncture, some insurance companies have started to consider this acupuncture services and they've started reimburse as well. Here it is, the coding is pretty easy. There are acupuncture points. There are like meridians. Along the meridian there are various points like pressure points. So what happens? This therapeutic medicine is aimed at like healing the patient by activation of these pressure points or the acupuncture points. So here what happens is there are two ways of stimulation. One is electrical stimulation, the other is mechanical stimulation. If the doctor is just placing the needles into the acupuncture points, we have codes for that to report. So you should know the number of points that are treated. Okay, and then if the provider is going to give electrical stimulation via passage of current, then we can report it as a electrical stimulation. So you also have the add-on codes, based on the time that is being spent. For the first 15 minutes you can code 97810, and for the next 15 minutes you can code CPT 97811. Now what happens here is you should understand, like, if it's going to be an electrical stimulation, it is 97813 and the add-on code would be 97814. Here you should understand the add-on code should be reported not just for the time factor, but there should be reinsertion of needles. That means the doctor should remove the needles from the original sites and then he would have to place it in the new acupuncture sites. Just because a doctor is treating for 30 minutes, you cannot report 97810 or 97811 or 813 and 814. Okay, there should be removal and reinsertion of needles at new acupuncture points so that you can report the add-on codes.